Welcome to Roadmap to Residency Evidence-Based Applications. Hello everyone, I'm Aviraz. Welcome to our Club 250 Matchmaker sessions. We are currently in our psychiatry modules, and we will be running through some questions with you guys to help you on a journey to a 250. This video is all about obsessive compulsive and related disorder. So, which of the following is the most likely primary diagnosis? A 14-year-old girl is brought to the office by her mother due to unusual behavior over the past year. The mother is concerned that her daughter seems overly anxious about eating and says during lunch she spent 45 minutes cutting the broccoli on her plate until all the pieces were the same size. The patient recently became a vegetarian and spends hours in the grocery store selecting vegetables and checking nutritional information. She also seems very concerned about her appearance. She brushes her hair 21 times on each side and parts her hair strand by strand and plucks her eyebrows for an hour daily. The patient says, if I don't keep things exactly even, I'm afraid something bad might happen. And the patient is medically healthy and has not yet started menstruating. She weighs 45.8 kg and is 157.5 centimeter. BMI is 18.5. Physical examination is normal with the exception of extremely sparse eyebrows. Which of the following is the most likely primary diagnosis? Anorexia nervosa, body dysmorphic disorder, generalized anxiety disorder, obsessive compulsive disorder, or obsessive compulsive personality disorder. So, talking about obsessive compulsive disorder is when you have obsessions like recurrent, intrusive, anxiety-provoking thoughts, urges, or images. Clinical features also contains of compulsions like response to obsessions with repeated behavior and mental acts. Behaviors not connected realistically with preventing fear event, and the events are time consuming and they take up more than 1 hour per day or causing significant distress or impairment for the patient. Treatment include SSRI, that is selective serotonin reuptake inhibitor, or cognitive behavioral therapy like exposure and response prevention. In these patients, repeated behaviors with food and grooming appear to be compulsions performed in a response to an obsession with symmetry and exactness, which is consistent with the primary diagnosis of obsessive compulsive disorder. Obsessions are persistent and unwanted thoughts, urges, or images that often drive an individual to perform compulsions, which are ritualistic behaviors and mental acts, example, counting to 21 to alleviate the anxiety or to prevent a fear event, like in this patient. In this situation, the patient's obsession with symmetry results in compulsions to cut her food into uniform pieces and groom her hair evenly to prevent a bad outcome. Compulsive behaviors in OCD are often illogical. Example, skipping over sidewalk cracks to prevent injury to a relative, or are excessive in nature. Example, checking if the front door is locked 50 times a day. For diagnosis, obsessions or compulsions must be time consuming. That is, they may take more than 1 hour per day or cause significant distress or functional impairment. Now, OCD is typically a chronic disorder starting in childhood or adolescence. That's what we say that is this patient has a normal BMI based on age and sex, and her usual eating behaviors are related to her obsessions and compulsions rather than an intense fear of weight gain. In body dysmorphic disorder, individuals have a preoccupation with perceived defects in physical appearance. In contrast, these patients' eating and grooming rituals are driven by symmetry obsession and the need to prevent a feared event. A generalized anxiety disorder involves excessive worry about the multiple issues and is not associated with intrusive thoughts and compulsive behaviors. Obsessive compulsive personality disorder involves a lifelong pattern of insistence on control, orderliness, and perfection, and does not include frank obsessions and compulsions that are present in OCD. Personality disorders are generally not diagnosed before age 18 or in young adolescents and will not explain this patient's recurrent compulsions performed in response to anxiety-inducing obsessions. Trichotillomania, that is a hair pulling disorder, involves recurrent pulling of hair and repeated attempts to decrease or stop the behavior. It would not be diagnosed in this patient who pulls out her hair as part of her symmetry, obsession, and compulsions. Now let's do one more question here. Treatment of this patient disorder is most likely to involve medication affecting which of the following neurotransmitters. A 48-year-old man comes to the office due to a concern that his skin is excessively dry, red, and cracked. The patient explains that he washes his hands each time he touches something due to fear of contamination. He spends 3 to 4 hours a day washing his hands and showers multiple times daily. He was recently fired from his job after refusing to touch keyboards shared by co-workers and is worried that he will be unable to find employment. On physical examination, the problems are erythemas and with peeling skin. Treatment of this patient's disorder is most likely to involve medication affecting which of the following neurotransmitter: acetylcholine, dopamine, gamma-aminobutyric acid, glutamine, glycine, histamine, norepinephrine, or serotonin. We have discussed about the treatment of this condition in the previous slides. You should be able to answer this question. So again, the treatment is a selective serotonin reuptake inhibitor and cognitive behavioral therapy. So this patient's fear of contamination leading to compulsive washing rituals is consistent with obsessive compulsive disorder. Now, OCD is characterized by obsessions or compulsions, with most patients experiencing both. Okay, if the patient only experiences obsessions, it is called as OCD type pure O. Now, common themes include contamination, obsessions with cleaning compulsions, obsession with symmetry and compulsions involving ordering and counting, and fear of harm with checking compulsions. Patients with OCD typically engage in time-consuming rituals and that cause significant distress and are functional impairment. Patients with washing compulsions may present with skin conditions, selective serotonin reuptake inhibitor, antidepressants, and considered first-line treatment for OCD. Now, SSRIs block the reuptake of serotonin into the presynaptic neuron, leading to an immediate increase in availability of synaptic serotonin and a subsequent cascade of downstream neurobiological effects. Let's do one more question here. What is the most likely diagnosis for this patient? 25-year-old man seeks psychiatric evaluation due to persistent distress about his physical appearance. He is preoccupied with perceived flaws in his facial features, particularly his nose, and spends several hours each day examining himself in the mirror. Despite reassurance from others that his appearance is within the normal range, he remains convinced that his nose is deformed. Now, this preoccupation has led to significant distress, social withdrawal, and avoidance of social situation. Now, the patient has a history of multiple unsuccessful cosmetic procedures aimed at altering his nose. He denies any concern about weight or general body shape. What is the most likely diagnosis for this patient? Social anxiety disorder, obsessive compulsive disorder, body dysmorphic disorder, narcissistic personality disorder, or major depressive disorder. Now, the patient's persistent preoccupation with perceived flaws in his facial features, spending excessive time examining himself in the mirror, distress, social withdrawal, and repeated unsuccessful attempts to alter his appearance through cosmetic procedures are indicative of body dysmorphic disorder. Individuals with BDD often focus on specific aspects of their appearance, believing that they are significantly flawed, despite evidence of the contrary. Correct answer is C, body dysmorphic disorder. Talking about narcissistic personality disorder, that is option number D. Narcissistic personality disorder is characterized by an inflated sense of self-importance and a lack of empathy, not preoccupation with perceived flaws in appearance. So what happens in body dysmorphic disorder is that the patient have a constant feeling or believing that there is something wrong with how he look, seeing as big flaws things about her appearance that other people don't notice or consider to be very minor. They try to be sure about how they look. Okay? They keep on frequently checking the mirror. They plan on having treatment, like in this patient having cosmetic surgery. They try to hide features they dislike, example, clothing or making up as a camouflage. They judge how they look against certain standard. Okay, example, comparing themselves with others as an ideal appearance. Now, thinking a lot about how he or she looks and why he looks that way. He or she, the patient, tries to avoid situations where other people can see how they look. Okay, and they try not to look at themselves because it feels upsetting for them. The treatment of body dysmorphic disorder it goes on parallel with obsessive compulsive disorder. Okay, the medications are SSRIs, and exposure and response prevention is also very, very helpful. Cognitive behavior therapy is very, very helpful, and plastic surgery is not recommended in this sort of patients. Now let's do one more question here. What is the most likely diagnosis for this patient? So 30-year-old woman seeks help for a recurrent and compulsive behavior she has been engaging in since adolescence. She describes a strong urge to pull out her own hair, especially from her scalp, eyebrows, and eyelashes. The pulling is often preceded by a feeling of tension or anxiety, despite multiple attempts to stop. The patient finds it challenging to control the behavior. She spends significant time each day pulling out hair and feels distressed about the resulting hair loss. The patient denies any pleasure from the act and is concerned about the impact on appearance, and she has never intentionally ingested the hair. Now, what is the most likely diagnosis for this patient? OCD, major depressive disorder, trichotillomania, body dysmorphic disorder, or generalized anxiety disorder. Now, the patient's recurrent and compulsive hair pulling behavior, the sense of tension or anxiety preceding the act, difficulty controlling the behavior, distress about hair loss, and the absence of pleasure from the act are indicative of trichotillomania. Now, trichotillomania is a body-focused repetitive behavior characterized by the recurrent pulling out of one's own hair. Now, we have discussed all other options in the previous slides, so you can just pause the video and read down the following options. I will just move forward to this. So, trichotillomania is when the patient pulls out their own hair habitually to see the point of to the point of seeing noticeable hair loss and experiencing pleasure or tension relief from the behavior. Now, this does not include hair loss as a result of medical conditions, and the disorder must result in a clinical distress or impairment in life function. Now let's do one more question here. So what is the most likely diagnosis for this patient? A 35-year-old woman seeks help for a distressing behavior she has been engaging in for several years. She describes recurrent and uncontrollable urges to pick at her skin, often resulting in skin lesions. The picking is not limited to specific body area and can occur on the face, arms, and other exposed area. The patient acknowledges that the picking causes significant distress and impairment in her daily life. Now, despite numerous attempts to stop, she finds it challenging to resist the urge. The patient does not derive pleasure from the act and feels embarrassed about the resulting scars. And what is the most likely diagnosis for this patient? Obsessive compulsive disorder, major depressive disorder, excoriation disorder, body dysmorphic disorder, or generalized anxiety disorder. So you must be able to answer this question just by the diagnosis of exclusion. So the recurrent and uncontrollable urges to pick at the skin resulting in skin lesions, significant distress, impaired daily functioning, and embarrassment about the scars are indicative of excoriation disorder, also known as the skin picking disorder. Excoriation disorder is characterized by repetitive skin picking that causes tissue damage. Okay, and we have discussed all the following options which are wrong in the previous slides. So you can please pause the video and read the other options. Thank you for watching. Keep studying hard.